MS Ramaiah University of Applied Sciences.
Hi students, bleeding time, Duke bleeding time fingertip method. Aim of the experiment: to determine the bleeding time of the blood and to indirectly assess the platelet function. Introduction: bleeding after injury is a common experience for most of us, but bleeding stops automatically within a few minutes. However, suspicion of a disease arises when there is a frequent and prolonged bleeding with minor injuries such as during shaving, cutting of nails or a fall on the knees. Hemostasis. The term hemostasis refers to the process of stoppage of bleeding after blood vessels are punctured, cut or otherwise damaged. Hemostasis, which is a hemostatic mechanism to prevent loss of blood, is a result of a complex natural physiological responses. Hemostasis involves the following four interrelated steps: vasoconstriction, contraction of injured blood vessels; platelet plug formation, formation of a blood clot; fibrinolysis, dissolution of the clot. Determination of bleeding time is a useful hematological tool to test the platelet plug formation in the capillaries. Bleeding time is the time interval between the skin puncture and the spontaneous unassisted, that is without pressure, stoppage of bleeding. The bleeding time test is an in vitro test of platelet function. Experimental setup: clean filter papers, blood lancet, stopwatch, 70% alcohol, cotton swab. Experimental procedure: bleeding time, Duke's bleeding time fingertip method. Get a sterile finger prick to get free flowing blood. Start the stopwatch and note the time. Absorb the blood drop every 15 or 30 seconds once by touching the puncture site with the filter paper along the edges without pressing or squeezing the prick. Note the time when bleeding stops, that is, when there is no blood spot on the filter paper. Encircle this spot. This is the end point of the experiment. Count the number of blood spots and express the results in minutes and seconds. Precautions: cutoff time 15 seconds. If bleeding continues for more than 10 minutes, stop the test and press the sterile gauze on the prick. Inform the concerned person about bleeding. Hi students, in this experiment we are going to study about bleeding time. The aim of this experiment is to determine the bleeding time and to indirectly assess the platelet function. Bleeding time is the time interval between the skin puncture and the spontaneous unassisted stoppage of bleeding. The bleeding time test is a useful tool in the study of platelet plug formation. It is one of the hematological experiment which is most of the time performed along with other coagulation tests such as prothrombin time, fibrinogen and platelet count. The purpose of this experiment is to aid in the diagnosis of patients suspected of having an bleeding disorder. Now, let us study various requirements involved in this experiment. Blood lancet. Blood lancet, which consists of a sharp needle to prick the finger bulb. Lancet holder. Lancet device. This is utilized to hold the lancet. The depth of the prick or the length of the needle can be adjusted by a calibrated knob which is provided in the top. Cotton swab with alcohol to sterilize the finger bulb. Dry cotton swab to remove the excess of alcohol. filter paper with following markings. Filter paper, which consists of the title of the experiment and markings for every 15 seconds interval and a stopwatch to measure the time. Now let us start the bleeding time experiment. First, sterilize the finger bulb with cotton swab containing 70% alcohol. The finger bulb has to be cleaned from both the sides and allow the alcohol to vaporize. After the alcohol vaporizes, you can manually use the pricking needle to prick, or you can use the automated lancet device to prick the finger bulb. After the alcohol vaporizes, take a bold prick using the lancet device and switch on the timer simultaneously, and the blood drop which will be formed will be blotted for the 0 second. After pricking, squeeze the finger bulb slightly and the 0 second will be blotted first. Then for every 15 seconds, keep blotting at the highlighted area. When there is no trace of blood, that particular circle will be considered as the end point of this experiment. The bleeding time was found to be 1 minute 15 seconds. This completes the bleeding time experiment.
At MSR UAS, we spark your imagination unlike any other.